Most people think a concussion is just a headache. But if you're 2 months out and you're struggling with sudden anxiety, irritability, or a brain fog so thick you can't finish a sentence, you know it's more than that. You're not losing your mind. You're losing your neurological balance. Today, I'm going to show you how a concussion physically traps your body in fight or flight mode by irritating the most important nerve in your body, the vagus nerve. You see, the vagus nerve is your body's air traffic controller for keeping things calm. It exits the skull right next to the atlas bone. When you sustain a concussion, the whiplash forces your atlas bone out of position, right? Even a microscopic shift creates a mechanical irritation on that nerve. And when the vagus nerve is compromised, your rest and digest system shuts down and your survival system takes over. This is why you feel anxious in a grocery store, or why you can't sleep even though you're exhausted. It's not a psychological flaw, it's a structural interference. But what about my brain fog, you ask? That's easy. You see, your brain needs to wash itself every night with something called cerebral spinal fluid. And that fluid has to go down the drain. The drain runs out your neck. And if the cranial cervical junction, that is your C0 and C1, your skull and your spine, is misaligned, it's like putting a kink in a garden hose. The trash stays in the brain, inflammation builds up, and you feel like you're living underwater. You can take all the supplements in the world, no different than flushing a whole bunch of toilet paper down the toilet. But if the drain isn't still clogged, the fog will not lift. In my office, I just don't ask you how you feel. You already know how you feel. I test how you function. I look at your autonomic balance and I check the integrity of your vagus nerve every single visit. If we find that your atlas is indeed the source of the kink in the hose, it's my job to provide a precise adjustment to clear the drain and the path. When the pressure comes off, the nerve and brain can finally switch from survival mode into healing mode. The plumbing will drain properly, and you will start to have normal restoration of health. If your personality has changed since your injury, if you're more reactive, more anxious, or just dimmer than you used to be, stop waiting for it to go away. Your vagus nerve needs help. Your nervous system needs help. Your upper cervical spine needs help. Your drain needs to be unclogged. Click the link below to schedule a nervous system consultation and upper cervical assessment. Let's get those lights back on. I'm Dr. Kramer, and I'll see you in the office.